PTSD, which stands for post-traumatic stress disorder, is a major issue that unfortunately many people have to deal with. According to PTSDUnited.org, 70% of adults in the U.S. have experienced some type of traumatic event at least once in their lives. This equates to approximately 223.4 million people. An estimated 8% of Americans, 24.4 million people, have PTSD at any given time. This is equal to the total population of Texas. Some signs and symptoms of PTSD are flashbacks and nightmares of a traumatic event, numbness and avoidance of places, people, and activities that are reminders of the trauma, difficulty sleeping, concentrating, feeling jumpy, and being easily irritated/angered. Causes and risk factors. PTSD is either caused by a traumatic event or a series of events. Almost everyone who experiences a traumatic event is at risk to develop PTSD, specifically people who are in a position or forced into a position to experience a traumatic event, such as veterans, rape, domestic violence victims, and natural disasters. Diagnosis and treatment. For someone to be diagnosed with PTSD, a medical professional must conclude that they have at least 3 signs and symptoms. There are a variety of treatments. However, I'm going to only highlight 3 of them for time's sake. The first one is prolonged exposure, PE. Teaches you how to gain control by facing your negative feelings. It involves talking out about your trauma with a provider and doing some of the things you have avoided since the trauma. The second one is cognitive processing therapy, CPT. Teaches you to reframe negative thoughts about the trauma. It involves talking with your provider about your negative thoughts and doing short writing assignments. And then the third one is eye movement desensitization and reprocessing, EMDR. Helps you process and make sense of your trauma. It involves calling the trauma to mind while paying attention to back and forth movement or a sound, like a finger wave side to side, a light, or a tone. Prevention/management. You can't prevent PTSD, but you can limit the likelihood of getting it by not working or being in situations where trauma is more common. There's management strategies that may work for you or a loved one with PTSD. First, take care of yourself. Get enough rest, eat a healthy diet, exercise, and take time to relax. Try to reduce or avoid caffeine and nicotine, which can worsen your anxiety. Second, don't self-medicate. Doing alcohol or drugs to self-medicate isn't healthy, even though it may seem like the only way to cope with PTSD. It can lead to more problems down the road, interfere with effective treatments, and prevent real healing. And if it is your loved one with PTSD, offer to attend medical appointments. If your loved one is willing, attending appointments can help you understand and assist with treatment. Thank you for listening to me talk about this very important issue. PTSD is a word that many among us have to fight each and every day. So, if you have any questions, comments, or concerns, please contact me.